Explain the art of stroke care and the treatment that's available, the options at Greenwich Hospital.
Yeah. Well, again, I think the biggest advancement that we've had is getting the primary stroke designation, because, you know, before we had that, we managed stroke, we gave TPA, we gave clot busting medication, but we really did not have the degree of coordination between departments. And to get things done fast, I mean, if somebody comes in, they've had a stroke, now they're 2.5 hours out, every minute counts. So, you know, with the stroke system of care we have at the hospital, which is really cuts all departments from, you know, the support of the administration all the way down to the people who are picking up the blood that know that the tube that says stroke has to get to the lab fast. So you have to educate all those levels. So that's been the really great advancement for us, is that it's expedited the care so that we can deliver those clot busting medications, which we did before, but now we can do much more efficiently. You know, we're lucky to have a very good radiology section at the hospital, where we can get scans. You know, we have state-of-the-art scanners looking at brain tissue, brain vessels. We're lucky to have a strong neurosurgical department, where if there's a big clot in the artery of the carotid, for instance, or if there's a big bleed that needs to be evacuated, we have access to that kind of care. So the systems of care, the availability of our therapeutics, the other supporting kind of medical departments as well, that says a lot.
Roughly, doctor, how many people come into the hospital with a stroke?
In our hospital, we see about 250 to 300 acute strokes.
Per year?
Mostly ischemic type strokes a year. That's right.
And is that, do you think that's going to increase because people will be hopefully more aware of what you've been talking about here with us today on the program? That usually happens when somebody knows more about a disease or a happening. The figures will increase, but that doesn't necessarily mean that
there's more disease there, right? Yeah, I think it's both. I mean, last time we had a radio show together, a patient came in and said, "I had heard your show the other day, and they came in the emergency room. I was having these symptoms." You know, so they recognized, you know, the symptoms. And again, so the public awareness will certainly increase the frequency that people will attend to it, but also it's curious. I don't know where it's going to go in terms of the future, in terms of the incidence, because as people are managing their risk factors more, they know that they have to treat their cholesterol. They know they have to treat their hypertension. Heart disease and stroke may decrease a little bit from that. The problem is the increasing aging population.
Yes.
And age is an independent risk factor for that. So I think it will probably even out in the end.
How many people are working for the most part in your stroke program at the hospital, in the center?
Oh, you know, for the stroke program, when we have a stroke alert, which is part of our stroke program, which says there's a stroke coming in, let's send out alert to everybody who needs to be involved. We have about 12 to 15 beepers that go off. So that's just 12 to 15 individuals right off the bat are made aware, from the neurologist on call to the radiologist to the technician to the bed control to the ICU to the emergency room physician. So that's just initial. How many people participate per patient is hard to say. I mean, over the time, there's the nurses involved, there's the physical therapists, speech therapists. The case managers play an important role in kind of arranging physical therapy, where they go. I mean, the numbers are 20 or 30 per physician, per patient. That's a lot of resources devoted. And that's because, you know, we recognize that stroke is the #1 cause of disability over the age of 70 in the United States now.
Really?
The #1 cause of disability. If we can decrease those numbers, if we can get people to the point where they can maintain their autonomy, where they can go home, not only does it have a huge kind of psychosocial impact on the patient from a more larger kind of socioeconomic scale, you know, the costs are enormous.
So the better physical condition that man or woman, let's just take an arbitrary age, 70, the better physical condition they are, and they do have an ischemic or hemorrhagic stroke, whichever, their chances then are better to recoup from that because they have been in better physical condition than somebody obviously was let himself or herself go.
Yeah, that's fair to say. I mean, there are comorbidities. If you have uncontrolled high blood pressure, if you have uncontrolled cholesterol issues, your diabetes is not controlled, all those things, basically, the comorbidities, will affect the outcome. And the other thing we don't recognize often is what's your support network. Do you have somebody there? Do you have family? Do you have a support network there that can say, come on, get up. You can do this. Let's get you walking today. Here's let's do the crossword puzzle together. Here's a book. Let's stimulate you. That stimulation is incredibly important in terms of recovery. And the physical therapists and the healthcare professionals can do a certain amount of that, but the wider support network is equally important.
When someone comes in to Greenwich Hospital and they have a stroke, is there a round figure of how long they may be there? We hear that somebody comes in, they're taken care of, everything is good, you can go home in a couple of days or a week. Is there a time limit, if you will, for that?
Yeah, well, the national average for an ischemic stroke is 2.5 days. It's short.
Really?
Yep, which means a lot of people go home afterwards. There's really no limit per se in terms of how long they can stay. The insurance companies really tend not to say, well, this person has to leave now because we say they have to stay now. So you get the work done, you get them in, you give them time to kind of acclimate to what happened, educate them about what happened, educate about them what they have to do as well from that point forward, which is very important.
Well, I think you've done exactly what you just said there, educated a lot of people with this today. It's been an eye-opener as usual. I always enjoy these programs because you learn something each time. I certainly do. And I want to thank you, Doctor, for your time today and for all your efforts that you and your team are doing at Greenwich Hospital.
Thank you very much.
We thank you so much.
Very
good to see you. Thank you. Our very special guest today on To Your Health, brought to us by Greenwich Hospital, is Dr. Frederick Nahm, and he is the director of Greenwich Hospital's Stroke Program. Until next time, for To Your Health, thank you for joining us here on GCTV. I'm Jim Thompson.